so I can stay alive and help other people to stay alive. I'm 69 years old, and I've given my life to the Commonwealth of Massachusetts children.
I had to leave work, and because I'm high risk, and financially it's taking a toll on us, and mentally, emotionally, it's just been very hard.
For our own staff, I think it's 73% of our white employees have been vaccinated, compared to about 30% of our black employees.
There are two major reasons for that. One is a bit of understandable vaccine hesitancy, but you don't want to hide behind that. It's that we've got to really extend ourselves into the community to get the access to minority populations that they don't have.
We want to talk to you.
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 We want to talk to you about getting vaccinated against COVID-19.
Across America, the pandemic has taken the lives
of more than 400,000 people.
400,000 people.
With 3,100 people per day.
3,100 people per day
dying of COVID-19 in January of 2021 alone.
I urge you to please make the right choice. And if you're not able to make that choice for you, make it for that family member, for that grandmother that wants to give you a hug. This is not a joke. You have seen the numbers. You have seen how much families have lost loved ones.
Hello and welcome to Narrative. I am Crystal Haynes, and I'm so excited because today we are talking about vaccine equity. And for folks who don't know what we do here on Common Narrative, we break down the media's impact on public perception and civic engagement across all lines of diversity. And like I said, our topic is vaccine equity. And my esteemed guest here today, I love all of the empowered women that are on this particular call as well, is Ava Malona. She is from the Massachusetts Immigrant and Refugee Association. They have a coalition of folks working on this particular issue, which also includes Dr. Tia Martin and Michelle Wu, who is, as you guys might know, Boston City Councilor and also mayoral candidate. So welcome, ladies. I appreciate you all for being here.
Thanks for having us.
Thank you for having us.
Well, I want to jump right in because I think this topic of vaccine equity has been one that has been going on, that has been discussed basically since the rollout, especially when it went right to an online platform. And that cut folks out of the process. And then the large vaccination centers that were set up by the state were not centered in communities of color. And so I'm thoughtful, and Michelle, I want to start with you, on a government leadership perspective. When you first heard about that particular setup for folks getting this life-saving vaccine, what came to mind as you as someone who knows about city planning, who knows about government structures?
The heart-wrenching and infuriating part of this was that we knew what was going to happen. We had seen this so many times already throughout every other part of the pandemic, that the burden, the inequities, the barriers would be squarely on communities of color, and specifically Black and Brown communities, immigrant communities. And so you have the efforts of, for example, the Black Boston COVID Coalition for more than a year at this point, of so many community side organizations, Ava and others, knowing what to do, knowing how to reach people. And yet the state's rollout continued to cement this idea that it was going to be top down, first come, first serve, technology based. And so, now a couple months in, thanks to so much organizing and coordinated advocacy from community groups who had been on the ground for a long time, we've seen changes, major pushback and then an adjustment, major pushback, then an adjustment. And now it's much closer to the point where community groups are leading and facilitating the outreach and registration and signups. But we could have been here a lot sooner on if we had understood that this last phase to end the pandemic needed to change the dynamic of everything that had happened before.
Dr. Martin, jump in here.
So, only thing I'll add to this is from a Black Boston COVID-19 Coalition perspective, as Councilor Wu mentioned, we knew that this was going to be the outcome. We knew that there was going to be disproportionate burden and suffering in communities of color. And because of our historical context and present day realities, that was going to disproportionately burden Black, Indigenous, Latinx, and people of color across the board. And so the frustrating piece really is that we didn't have to be here. You know, we were saying this back in March and April when we first started coming across the pandemic, or the virus, and then when it was declared a pandemic. And we know from research and experience that the people who bear the disproportionate burden of the suffering and pain during and after disasters are the same people who bear that disproportionate burden and suffering before a disaster. And so here we are with the predictable impact and outcomes. And so from testing to vaccines, we have failed in terms of developing approaches and policies that match what the best and promising practices are for how we deal with emergencies, which is why it has been such a privilege and pleasure to serve on the Black Boston COVID-19 Coalition Steering Committee, as well as the Vaccine Equity Now Coalition from a statewide perspective. So thank you for having us, Crystal, as well. And the last thing I want to say on this point is I just want to explicitly acknowledge the loss and suffering that people are trying to navigate in the middle of all of the chaos that COVID-19 has worsened for people. I think we sometimes forget the human face of the suffering because it's not on 24/7 on the news. But there are people who have lost whole families in their lineage, whole households gone. So I just say that so that we remember that this is about real people and people's lives. And my hope is that we're able to learn and grow and evolve in the ways that we need to, from policy all the way down to how we collaborate with each other when we organize.
And Ava, I want to ask you, we've had this conversation before, in terms of on the newscast, Boston 25 News, but, by having this online platform, by centering the first vaccination centers in specific communities, I imagine the immigrant refugee community felt left out and frankly afraid to go to these large spaces to get a vaccine.
Thank you, Crystal. It's a pleasure to be with you and my colleagues this morning. First, I also want to acknowledge that, the MIRA coalition, it's a multi-ethnic, multiracial coalition with over 130 institutional members on the ground. And I want to take this opportunity to give my heartfelt thanks to our members for the heroic work that they have been doing on the ground. They are the real heroes. And like Dr. Martin said, I also want to acknowledge, the loss and the pain that we all are experiencing, but in particular, the immigrant and refugee communities, and also immigrants of color and those in the mixed status household families. The last 4 years have been horrific for the foreign-born community, and COVID aggravated the situation even more. And as Dr. Martin stated, we knew that this inequities existed, and even harder for immigrant communities. But I also want to acknowledge how resilient and how strong immigrant communities have been. And those in the front line experiencing the losses, experiencing the pain, but also contributing with all their might to be part of the solution and to be part of what's happening in our Commonwealth and in our country. So yes, it has been extremely hard for the communities, and especially for the mixed status household families. It's very hard for them to deal with the very present fears of their existence and how immigration status interferes with all of that. So there is a lot of pain and struggles in the community. And this vaccine inequitable, situation makes it even harder for the immigrant communities, Latinx communities, and generally speaking, immigrant communities.
One of the big issues that has been discussed is vaccine hesitancy, especially in communities of color. And we know that there's obviously a historical, but also a contemporary context for that, a reason for that. And so I want, and I don't know, Dr. Martin, if you can frame this for folks better than I would be able to frame this for folks. I think a lot of people mention the Tuskegee experiment. Obviously, there are a number of instances like that in history. But when we're talking about hesitancy in communities of color to get this vaccine, and then that additional concern that came up as part of the news cycle with the Johnson & Johnson vaccine and the fear that one was less efficacious, and so then that would be put in communities of color because it would be easier, and Black and brown folks feeling like, well, why do we get this one that's less effective, right? So I wonder if you can speak a little bit to the hesitancy piece, the historical piece behind that, and how we move past that.
So thank you for that question, Crystal. I think part of the challenge is the narrative. There's a narrative that the reason people of color, especially Black and Latinx people, have not gotten the vaccine is because, the folks don't want it. And so what I would say to that is it's more complicated than that. And in fact, the most recent poll, a very recent poll that came out from PBS or NPR, excuse me, was very clear that when they polled across races and different political ideologies and a whole range of social categories, that in fact, for example, African Americans, Black people across the diaspora were the smallest group of people who said they would absolutely not get the vaccine. The smallest group of people who said they would absolutely not get the vaccine. So for me, that means that there's a flaw in the narrative we've been telling. Now, it is not to say that there aren't people in the community who have concerns, right? It is not to say that there isn't this historical context that creates questions for all of us around, should I even do this? I had quote unquote hesitancy, and it's not because I'm afraid of vaccines. It's because that there is this historical context that goes all the way back to before we were even officially a country, in terms of the medical infrastructure, healthcare infrastructure being built on the bodies of Black people, experiments that were done on enslaved Africans, that not just in America for the American healthcare system, but for the international healthcare system, predominantly Europe. And so if we understand the historical context and we understand that people are having experiences as of just this week that passed that were negative with the healthcare infrastructure, there's a reason why people are kind of questioning, because there's a broken relationship and a broken system when it comes to people's ability to access and navigate healthcare, as well as what it means when that brokenness, when the reality of racism sits on top of that brokenness of a system that doesn't work for most of us. Then you have that disproportionate burden of the problems with that system. The last thing I'll say on this piece is the other miss is providing people with good quality information. Part of hesitancy is that there's a focus of information that is not in plain language, that is not answering the questions that people care about, and just talking about this hesitancy without answering people's actual questions that are causing them to have concerns about the virus. So there's a lot of misinformation that has filled the black hole that we have collectively left for folks to be able to get good quality information so they can make good quality decisions. So I think for us, in the work that we do in communities and in partnership with government and in partnership with different organizations, that it really is important that we understand the narrative is more complicated than just vaccine hesitancy, because then we're putting the blame on individuals instead of owning our responsibility as part of the problem and leaving that door open so that we can also be part of the solution.
Absolutely. I want to read that the data you just pointed to. On March 12th, the latest NPR PBS NewsHour Marist survey showed that among Republican men, 49% said they did not plan to get the shot, compared to just 6% of Democratic men who said the same. And among those who said they supported President Trump in the 2020 election, 47% said that they did not plan to get a coronavirus vaccine, compared to just 10% of Biden supporters. It looks like this is running along political lines as well. And we do know that the federal rollout under the Trump administration was not stellar, to put it mildly. What are you hearing in community, Michelle?
So sorry, Crystal, there was a little bit of feedback. You directed, that was for me?
Yes, okay. Sorry.
I think we are still, we're still reeling as a community from the pandemic, from the trauma over the last 4 years of just the messaging and the attacks and just nonstop onslaught from the former federal administration, and with folks continuing even after the coup at the Capitol, and elected representatives at the federal level continuing to defend and to stand up for that kind of action. So I think the way that it trickles down to the city level is that we still need to define how our recovery will not just be a healing experience to restore what people had been used to before in terms of the feeling of economic activity or social connections, or being able to just go out and kind of live your life, but to really emphasize that we need to do something very, very different in this recovery. We need to actually address the underlying structural issues that communities of color, that Black, Indigenous, people of color had been bearing long before this virus came. And, I think especially within the Asian American community as of late, there have been many conversations about what that means in this moment of time, how we break cycles that we have seen again and again. And these conversations must be cross-racial, must be outside of silos. I think that's the goal as we're breaking out of isolation and quarantine and seeing more vaccination happening, however uneven and inequitable it has been so far. As we continue to push to get through this phase, how do we make sure that we are not just rebuilding our kind of economy overall, but rebuilding community in a way that is different, that is more connected, and allows us to have the social infrastructure to have the conversations that we should have been having long before this pandemic.
I want to play just a few voices in this conversation that I was able to collect at some of the vaccination sites, and just have you guys react, a little bit of what they were saying.
So I can stay alive and help other people to stay alive. I'm 69 years old, and I've given my life to the Commonwealth of Massachusetts children.
I had to leave work, and because I'm high risk, and financially it's taking a toll on us, and mentally, emotionally, it's just been very hard.
For our own staff, I think it's 73% of our white employees have been vaccinated, compared to about 30% of our Black employees.
So what do you think about some of those voices? And this is I went to a vaccination, actually mobile site at a church in Dorchester, and then I went to a Brockton site that was set up to get some of that sound. And the last voice there was from the Brockton Neighborhood Health Center CEO. And she spoke about, in some of these nursing homes and things like that, like folks just are refusing the vaccine. I mean, what's the concern there in those spaces?
Or you want me to jump in here?
Yeah, anyone can jump in here.
So one of the things is how we approach this, right? So again, we know that there's folks who are scared to get the vaccine, and usually with good information are able to make a good decision. And we've seen that pattern over and over again. So even with how we approach workers to get the vaccine, so we should be asking ourselves the questions: what is it that we're doing potentially that's contributing to the disproportionate response rate of our employees of color who have concerns? So if we are being honest with ourselves in terms of all of our collective responsibilities in being able to support people's access to the vaccine and to have their questions answered, then we'll probably see an increase in rates. And that's what we've seen on the ground from in terms of the Black Boston COVID-19 Coalition, is that people are always nervous at first, and not just because they're a person of color. And so when people get their questions answered, they're respected, their humanity is respected in the process, and they're not treated as if something's wrong with them because they have questions. They actually have a right to have questions. And when that is ignored, people will take a position that is not actually aligned with not in line with their best interest in some cases because of the level of disrespect that people experience. And I'm not accusing the CEO of that. What I'm saying is there are opportunities for us to look at our role and responsibility and how we're approaching employees to be able to get this vaccine. And then I'll just land here with much of how we approach this work is about respecting people and their voice and their choice. And anytime you try to force something down anyone's throat without acknowledging that there are questions and concerns, inevitably what we're doing is perpetuating inequities and oppression without meaning to do so. We think we're doing the right thing, and by virtue of doing that, we tend to create these outcomes that disproportionately burden people of color because they're going to be on the disproportionate receiving end of being treated differently because they have taken a position or because they have questions or concerns about something and issues in an organization.
Hmm. Ava or Michelle, I'll have you jump in here. Do you think all of the voices that need to be at the table are at the table in this conversation? Oh, let me unmute you here. There we go. All right.
First, I just wanted to say that the quality of information is really key. The way we treat people is really key. The way we formulate the questions and we distribute that information is really key. And it needs to be part of a narrative of inclusiveness, that we are in this together. But if, we see inequities that are so present that we're not in this together. So it's extremely important for all. And, being an advocate for, the immigrant population, I also am concerned because there are additional barriers for, the foreign-born population. And I want to bring one example, the issue of IDs, that the intention is not to ask for IDs. They ask for one if you have one, but if you don't have to submit one. But the information, it's not clear. The policies and the narrative, it's not clear. We are hearing from people that, the very fact that if you have an ID, you need to present an ID, it's a huge barrier. And especially for the mixed status household families. There are over 250,000, immigrants in the category of either unauthorized to work or a mixed status family that are terrified just by the notion that, they need to show an ID. So there is so much work that needs to be done to really make sure that the information is accurate, that the policies are done right. Then, there is targeted communication and education and access to different languages for immigrant population. And, the clips that you just played, it makes me really emotional. The inequities are real. And we need to do something, and time is of essence.
And may I build on that, Crystal, too? That, we've been talking a lot about meeting people where they're at when it comes to providing good information and an inclusive process that is community driven to make sure people have everything they need to make a decision for themselves and their family. I really also want to emphasize just the physical piece of meeting people where they're at, that to remove barriers for people to actually get to where they need to be for those vaccinations. And there are many other cities around the country that are leaning into walk-in situations to remove barriers for even having to pre-register, to think about more opportunities to meet people at their homes for the homebound, thinking about whether it's deploying community trained public health professionals to go door to door, or EMS infrastructure. There are ways that, for me, and so many, I think folks who've been trying to think about how to take down these barriers, it is just as important to have that physical access, to have in neighborhoods, in BIPOC communities, Black, Indigenous, people of color communities, not, as Dr. Martin was saying, not to just accept the standard narrative of, oh, well, there's nothing that can be done about it because of, this common narrative, but are we actually making it possible for people who are working during 9 to 5 hours or multiple jobs? Are we, I think about MBTA workers who have been bearing a great deal of the burden of this pandemic, and yet Governor Baker has refused to allow a specific vaccination site to open that would allow workers to who already have priority and eligibility to actually get the vaccine, because there are rules. Bus drivers can't have their cell phones with them during the day. There's no way to schedule appointments for them throughout the day. And so just thinking about how once someone's decided to get the vaccine, there are still so many hurdles that we're putting up for them to actually physically get to where they need to go.
Thank you for, sorry. Go ahead, Ava.
One more thing I also wanted to add to this is the very strict guidelines of who qualifies as an essential workers. It's mind-boggling to hear the stories of people who have been vaccinated, and I'm very happy, it is universal vaccination, but it's just amazing to see how many people have been vaccinated who are or are not essential workers. And many others who really are at higher risk are still not vaccinated. So just targeting the definitions and the guidelines in a way that are all inclusive, I think it's very important. The complexities of the forms that people need to fill out, as Michelle was pointing out, it's really, really crucial.
And I was going to just add that this is an example of not using the best or promising practices. Right. So we know from decades of pandemic preparedness and pandemic planning in this country, in this state, at the local levels, what we should be doing. Right. And it's not just open up mass vaccination sites. It's mass vaccination sites, it's community health centers, community clinics, and it's mobile vaccinations, which means two things. Sites that are in communities, filling in the gaps of where healthcare infrastructure does not exist. And it's bringing it to people's homes who cannot leave their homes for lots of different reasons. Oftentimes we think about homebound people in the context of having a medical condition or disability that prevents them from leaving the house. And it includes people that have a lot of children in their household, and we're in a pandemic, so you can't get a babysitter. It includes the off-schedule folks who, to Councilor Wu's point, who, are working shifts that don't allow sometimes for them to even have the flexibility to commit to an appointment a week in advance, or because they don't know what their shift is going to be. So there's lots of reasons why we need to kind of bring it to where people are. And it's the collection of those strategies that will allow us to have community immunity, right? However, we have not taken those approaches. And I've said this before, but even as much as we can criticize the Trump administration, one thing they did explicitly write in their Operation Warp Speed plan, in the summary for it, was this exact approach. Mass vaccination sites, community health centers, community clinics, mobile vaccinations, and bringing it to people's homes, because it's a best practice. And so the idea that we as a Commonwealth, who has been a leader on so many fronts, are doing something that is different from what we know is the right thing to do. And not just because it's nice to do it, but because that is the industry standard from an emergency management perspective and a public health perspective on what we need to be doing in order to address this pandemic and, quite frankly, any other issue that we're facing. And what I mean by that is kind of targeted strategies that allow us to reach these universal goals. If we want everyone to be, as many people as possible to be vaccinated, so that we can get over this pandemic, that means we need to have multiple strategies and multiple approaches to meet the needs of multiple people. And anytime we develop policies or programs or initiatives that do not take into consideration the different realities different communities have, we fail, because we are going to inevitably exclude them, especially if their voice is not at the table. And especially if we're not going to the tables where people are in order to hear their concerns. And I'll stop there.
I think that this conversation has been continuing on the federal level as well. And Massachusetts Senator Ed Markey held a COVID roundtable a little while back. And so I wanted to play, I mean, this was back in February, and I wanted to play some sound from that.
We cannot turn our backs on these communities that continue to shoulder the burden of this pandemic.
If anybody can walk into Brockton and convince Cape Verdean and Haitian patients, community residents, to consider taking the vaccine, that's Brockton Neighborhood Health Center, just a few miles down the road from me right now.
We want lots more vaccines going out. We want everybody to be able to get those vaccines. So more money into vaccines and more money into distribution generally. But the next level down is we are articulating in this bill, it has to go to community health centers, because community health centers are where we get it done.
We've mapped out social systems to see where are the leaks and where is the capacity. This hasn't been done. Look at the collective care and mutual aid that has emerged in the midst of this tsunami of hurt.
Yes.
The human infrastructure, the care economy, you know, when we thought it was improbable. That is where the resiliency of community has come with this.
Ladies, I want you all to sort of respond to that sound. Of course, we heard Senator Markey, Senator Elizabeth Warren, Representative Nika Elgardo, and then we, of course, Congresswoman Ayanna Pressley. That was the last voice if you are listening at home. And so I want you all to respond to some of this, because it seems like there's a conversation, obviously, on the federal and state level to affect some of this change. And it had started back in February when we saw the vaccine program roll out.
I'll open up just to warm it up here with this question. I think I was just feeling an incredible amount of relief at our delegation and those voices, and I wish there were had been a sooner incorporation of so many of those insights and strategies. And as we've been talking about all morning, I think for me, what came to mind right away is that we can't let up, right? That it seems right now, obviously there's still a long way to go in terms of reaching herd immunity and full vaccinations. I was just checking the latest stats earlier this morning that about 35% of Bostonians 16 years and older have been vaccinated as of the last major batch of data. And so even that is a huge place different than where we were, a couple months ago. Still more to go. But even after we are pushing through vaccination, this same sense of coordination, urgency, focus, and intentionality has to continue. It will be in the impacts that are still tied to the pandemic, that are not measurable by epidemiologists around the mental health impacts, the trauma that families have experienced, the burden that's going to continue on our schools, and so many who have been affected and bearing the burden of care infrastructure sort of pulled out from under them throughout the course of the pandemic. And we just have to keep building and not let up once it feels like, okay, restaurants and indoor dining are safe in-person events are safe to go to again. We have to stay in this mindset that there's so much more still to do, and to make sure that we are rebuilding in an equitable way.
I'll just add that we are in a strange time right now. And what I mean by that is there are all of these ways that we're framing problems that make individuals on the ground, communities, the problem, instead of the systems and structures and healthcare and kind of all of the different parts, government, and all of the different roles that we all play in when we're trying to work through difficult issues, complex issues. And so what I find fascinating right now is this opportunity that we have to really learn and to really look at all of the things that we have been able to make happen that a year ago we said that's not possible. We would never be able to do that. And and there's some of those lessons that we've learned that highlight even further inequities. And I'll give a concrete example. So we've always said that students have to be in the classroom, and that's the only way that they can learn. And so we've gone through a year of virtual learning, remote learning. Now here's the rub. Because we did not build the proper infrastructure to make sure that all students and their parents have access to good quality internet, then we found ourselves in a situation where there were students who could not get access to the very education that's supposed to help them to navigate getting out of the struggles that some of their families are dealing with, right? We say education is a pathway out of poverty. Now there's some debates about that on the nerdy side of the house. However, the reality is it's an important pathway. And so when we make policy decisions and we don't take into consideration the benefits and the burdens and who's going to bear each of those things or who's going to have access to each of those things, we end up in these kinds of situations. I say all of that to say that it is my hope that we truly, collectively, at the local level and at the state level, deconstruct some of the decisions that we've made, the impacts that they've had on communities, so that we can really learn from them, that we do an after action report about this situation that centers equity in the middle of it, so that we can make sure that we are moving towards this type of resilience that isn't just about how do people cope and adapt with all of the problems of our society and the worsening of them when disasters and emergencies happen, but how do we make sure that we are transforming the root causes of the experiences that people are having? And we can't do that if we are too afraid to look at the mistakes that we've made so that we don't make them again, as well as the things that we did that were innovative, that we can leverage as tools, as long as we have certain considerations in mind to make sure that, again, that they are that those strategies and approaches align with what the real needs in communities are and the realities in communities, so that everyone can benefit from them and leverage the different things that make sense for people and their families.
If I may, I just wanted to bring us back for a moment to the importance of building the right narrative and, the narrative of togetherness. coordination, collectiveness, inclusiveness, I think it's key. We can see the communities who have suffered the most as a problem to be fixed. We need to see that as a failure to building the right systems, to invest in our communities. And I cannot emphasize that enough, that the communities need to be at the table. Congresswoman Presley says it many times, and we love quoting her, that those close to the pain should be close to the power. And the voices of the most vulnerable should be at the table when these policy recommendations have been made. And it's one of the things that I'm really proud of Dr. Martin's work and many other colleagues that I'm privileged to work with, that in February we got together and we formed the Equity Now Coalition that has over 30 hardworking, on-the-ground organizations that stand for social justice, racial justice, immigrant justice, and health equity. And the concern that we share together is that we are still not learning from our failures. And this coalition's mission is coming together, recommending solutions. We all are tired of just pointing out what's not working. I think it's time to get the best lessons learned, those promising practices, and coming together with concrete solutions moving forward. I want to acknowledge the incredible amount of work that has been done at the local, federal, and state level. I mean, the administration has put an enormous amount of time and endless hours and efforts and resources at the federal level as well, at the local level. Enormous work has been done, and I want to acknowledge that it has been powerful. But the narrative of bringing the voices of those who are being disproportionately affected need to be at the table. They need to have a say. And one of the things with the Vaccine Now Coalition is that we work with them, for them, and with them, and not just making decisions for them.
I want to ask you all, as you've been watching the news reporting on this, do you think that the media is being fair in its representation of the facts? And I'm thoughtful of this in the context for myself is that I was on the Mashpee Wampanoag lands earlier this week, and they are really crushing it when it comes to this vaccine rollout. So much so where they have surplus vaccine where they're vaccinating all the Mashpee teachers in that district, and starting on Friday, the Falmouth teachers. And they're sharing it with community. And you're hearing stories, albeit here and there and very sparingly, that in Native American communities, they're actually have done such a good job in connecting to the folks that are on the reservation, on the tribal lands, that they're actually helping the surrounding communities. And I'm thinking about that community model that already exists in that space and how it worked effectively for them. And so they were able to reach out to the surrounding communities and apply it there. And so my question to all of you is, do you think that the media tells enough of success stories in this space, and also talks more frankly enough about what needs to be done here, and challenges the folks that need to be challenged on a public scale?
I will say that I think it's a mixed bag, right? So, the ability to do storytelling well requires us to have done homework, to have a certain level of understanding of context. And there are some media outlets and all the way down to reporters who have done that legwork. And so they have a deeper understanding of the inequities that already existed, of oppression, of those types of things. And so the narrative that they tell is a little bit different from someone who has not done that research. And so it's not just about the individual reporters, it's also about what is it that media outlets are expecting from their reporters, and are they provided the space to be able to get the kind of knowledge it takes to tell accurate narratives, and let me reframe, from accurate to more complete narratives. And what I mean by that is if you think that if your worldview ultimately is that people of color are helpless victims and they need to be saved, right? Then the stories that you tell about those communities will be about them being victims and how all these other people are coming to save them, as opposed to all the work that's happening and has been happening in communities to save themselves in spite of other folks not making that investment in those communities. And so I would say from a media perspective, there's always room to do better and be better. And I think as part of this pandemic, what I've noticed kind of more towards the later, the last several months, is that there has been a better job. I would say that there has been a better job of telling some of those stories. My hope is that that it's not an anomaly, right? That we continue to tell these more sophisticated stories around that match the complexity of the real world, of real communities, of their strength and their challenges, in the ways that we in different parts of society, whether it's government, business, nonprofits, community, can play a role in being able to and play a role in being able to be a part of the problem and part of the solution. And so how do we get more intentional about telling the full range of stories and all of the different roles in being in the problem and the solutions? And I'll stop.
Mm-hmm. And I totally agree in terms of the narrative and how do we present the stories. I do want to, and people like you, Crystal, who have been covering this issue, and your colleagues, I want to thank them for their attention, for their consistency in covering. But also, it's our responsibility also as an advocate how we talk about the issues and making sure that the powerful stories are being told and getting those stories to the media, and not talking about immigrants only as victims or as, this poor segment of the population that, has to survive. But also we need to tell that story of immigrants thriving and immigrants being in the front lines and they're being part of the solution and not as a problem that needs to be fixed immediately. So it is also up to us to get those wonderful and powerful stories in the media and, speak to that. So going back to the narrative, it's extremely important that there is a collectiveness and very strategically working together and telling the powerful stories of resilience and strength and the resourceful communities that we represent.
I'll add. I agree completely with what's been said, especially about the need for context and tying what is happening now with failures from long before, generational, since the founding of this country, and the role of policy in driving the issues that we're facing today and the urgency for moving forward on racial justice. I think that has, at least again in this moment, has become more infused in coverage on all issues and must continue. And then I just wanted to reflect that, in this current sort of point in time with social media, there are so many more people stepping up in addition to just sort of, mainstream media or even official, professional reporters and journalists. And it's been amazing to watch that kind of sort of grassroots information sharing, building, coalition work happening that I think we'll continue to see the impacts long after this pandemic is over as well.
And one more piece that I wanted to mention on this point is just the fact that we're all humans. And as part of our human condition, we're flawed and amazingly wonderful all at the same time. And so, and that goes for our reporters, our brothers and sisters who are reporters too. And all of that to say that we all have been infected with ideas about who people and communities are supposed to be and how they're supposed to be. And if we own the fact that we're flawed human beings and that those ideas are in us, whether we believe them or not, we have a whole catalog of those ideas because we get exposed to them all the time, and they come out in ways that are very unexpected, including how we write stories. And so in that context, making sure that we are aware of that and managing it. And that means getting closer to communities and owning mistakes when they happen, reframing deficit-based things, advocating. There are times where sometimes editors don't have the same context that you had as a reporter who was close to the situation, and they tweak things in ways that actually take away from the narrative. And I know it's hard, and we have to figure out what we're willing to risk in all the different spaces we're in. And there's an opportunity for us to speak out in those moments when we know that the narrative is being pulled in a direction that is harmful to people and harmful to communities.
And in the last few minutes that we have, I want to talk about vaccine passports, vaccination passports, because that has come up recently as more folks have been vaccinated in the state and in the country. And now there's a conversation around it being, a barrier to access for folks. If you already had disproportionate access to the vaccine, you're going to have disproportionate access to whatever this passport may or may not look like. And I know Governor Baker has said we're not there yet in this state, and that he didn't want to create a barrier to already, to make this job more difficult than it already is in getting everyone vaccinated. But I wonder, in an equity lens, when looking at vaccine passports through an equity lens, what are the challenges there if companies, if countries that folks want to travel to start implementing this?
Go for it, Dr. Martin.
Go for it.
I'm trying not to jump out there and make sure I'm creating space for other voices, because I know how excited I get about these issues. So I'll just quickly say that you kind of said all of the important points, Crystal, right? That there is a reality that if we head down that road, we create yet another way to marginalize people. And so we have to decide for ourselves in this moment how we're going to prevent that from happening, because we can see it on the horizon. And if we can see it on the horizon, it is all of our collective faults if we end up in that space when we blink and we arrive in the future and we have made decisions that that these vaccine passports can make or break someone's livelihood. And so we have to be honest about the groundwork that needs to happen to ensure equitable access to vaccines. And we have to make a decision collectively about what are the different ways that we can approach making sure that folks are able to go into spaces and folks be comfortable with the idea that or not be comfortable, but that we are clear about who has been vaccinated. And that's not an easy decision or approach that we have to navigate. It's going to be some healthy conflict that needs to happen for us to come up with solutions that make the most sense. What I'll say concretely here is that from a public health perspective, they're not necessarily mutually exclusive, right? That we can have approaches that don't require people to have a vaccine passport. We know there's barriers to just having an ID, and for immigrants, but also for any poor communities, for communities of color who are poor, but in communities who are middle class, that are communities of color, but there's transportation disadvantage. And so there are these realities of once you start to add another layer of barriers to people's livelihoods, like whether or not you can come to work or whether or not you can participate in certain types of activities, you begin to further stratify our society and create more problems in people's lives.
I totally agree with that approach. We're not there yet. And the inequities need to be addressed immediately. And once we get to a phase that, it's universal vaccine and the barriers have been eliminated, then we can talk about, the passport at that point. But the way things are right now, it's another added barrier in the process, and especially the timing of it. It's important to document it so people have, their cards when they, they have been vaccinated. But I don't think we're there yet to add the policy for a passport vaccine at a time that inequities are so present and so real.
Yeah, and I think this feeds right into the conversation we've been having about putting the burden on individuals rather than the system to take full responsibility, government policy to take full responsibility, that we must get to the point where this is not an issue, right? Where there has been access, where we've done the work of reaching every community and meeting people where they're at. And this is also a moment where we are still seeing very active efforts through policy to exclude communities from voting, right? From getting access to jobs, and when it feels like the pie is smaller as we're coming out of the recovery, and we just can't have no excuses when it comes to who's able to share in the prosperity of our society, especially as we are looking to grow and come back and transform our systems through this recovery.
All right, ladies, we're going to have to leave the conversation there, but my goodness, what a great conversation. Thank you so much for your time, Ava Malona for the Massachusetts Immigrant and Refugee Association, Dr. Atiya Martin, and Michelle Wu, Boston City Councilor and mayoral candidate. Thank you so much for your time. And just so if folks who may have missed this conversation, folks who maybe caught it at the last 10 minutes, we have streamed it to the Common Narrative Facebook page, the Common Narrative YouTube, and of course follow us on all our social media, Common Narrative Media, and set those notifications because we are going to be having some tremendous conversations as we go out through the year every Sunday right here from 12 to 1 o'clock. And I'm going to play us out with a recent PSA that went out with Boston elected leadership and appointed leadership. So I'm Crystal Haynes. Thank you so much for being with us.
Thank you.
We want to talk to 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 you about getting vaccinated against COVID-19.
Across America, the pandemic has taken the lives
of more than 400,000 people.
400,000 people.
With 3,100 people per day.
3,100 people per day
dying of COVID-19 in January of 2021 alone.
In our community, the virus has cut the average life expectancy
for Black people by 2 years.
And Latinos by 3 years.
8 out of 10 COVID-19 deaths reported in the U.S.
have been adults age 65 and older.
It's up to us.
It's up to us.
It's up to us.
It's up to us.
To stop the spread.
And protect our families.
It's up to us.
It's up to us.
It's up to us.
To protect our grandmothers,
our grandfathers,
and our families.
We can keep our communities safe and healthy by getting vaccinated.
By getting vaccinated.
By getting vaccinated.
We've got to keep our communities safe and healthy by getting vaccinated.
I was vaccinated a couple of weeks ago and it was safe and secure, and you should do it too.
When the vaccine is available to me, I am going to take it.
I'm going to do it.
I'm going to do it.
When it's my turn, I will do it.
As soon as I can, I will do it.
And you should do it too.
Please contact your local healthcare provider or visit
www.mass.gov for more information about getting vaccinated.
That's www.mass.gov for more information about getting vaccinated.
Get vaccinated now because it's up to us.